in the 1800s, medical care in Madison was provided in the home. So when you were sick, especially if you needed surgery, you'd call a doctor. The doctor would come to your home and provide that care. So sometime around that same time, in 1896 specifically, 12 women who cared deeply about this community started to do some community service. They volunteered, served the poor, just invested in the community. During one of their home visits to one of the neediest, they met a child, a boy, who had a diseased bone in his leg. This child clearly needed surgery and needed to be taken care of, but the conditions he lived in were completely unacceptable and not suitable for surgery. So the women wanted to do something about that. And so they went out and looked for a place for this boy to get the care that he needed. And they found a place. They found a nurse who was willing to offer her home for the surgery to take place. Unfortunately, the boy's father was not willing to move his child and refused the care. The women were heartbroken. But the heartbreak led to an amazing idea. And that's where the idea of a hospital was born. The need for a place where everyone could get care, regardless of their economic status, and get quality care, not just health care. And these women were the Bethany Circle of the King's Daughters and Sons, driven by a motto that all of us can be inspired by. Matthew 20, verse 17. If you have the faith of a mustard seed, which is really tiny, if you have the faith of a mustard seed, nothing will be impossible to you. And the faith that these women had is what drove them to not accept the status quo. So they came together and mobilized another 100 women from the churches around this region, raised money, and bought and then equipped the hospital that became to be known as King's Daughter Hospital. What an incredible story. To form a hospital then has served this community for over 100 years and has thrived and really made sure it took care of its patients. This is the specific story that led me to accept this position and move to Madison. I did not feel that I could not be part of this mission. I was inspired by the story, and I also felt the strength and the resilience of the women through the board members that I met, the members of the foundation, and even the spirit of Madison reflects that. And I felt that I needed to be a part of it. So who am I? A little bit more about me. I am the fifth daughter of 6 children, born in Ghana. So Ghana is a country in West Africa, to 2 wonderful parents who unfortunately are no longer with us. My father was a UN diplomat, and he was assigned to work at UNESCO. So UNESCO is a branch of the UN that is headquartered in Paris, France. And so at a very young age, I think I was 4 years old, I moved to Paris, France, and that's where I was raised till I was about 16 years old. For a very long time, French was my first language. I understood English. I somewhat could write it, but really French was my first language. And I got to move here to the United States on a scholarship to Central State University, where I got my undergrad. And then I went to University of Cincinnati, where I got my master's. Until today, I can barely spell Cincinnati. It's the most complicated city for some reason. But it became home to me for a long time because I met my wonderful husband, Eric, who was born and raised in Cincinnati. Hadn't been very far. I think the furthest he had been was Chicago when I met him. The Cincinnatians love to stay in Cincinnati. They don't leave Cincinnati. And I got to convince him to travel the world since. But that's our home base, where we have 4 wonderful children who live there. And this position has now moved me here to Madison to fulfill this mission. My career has really led me here, I believe. I started off at 22 years old as a consultant, traveling the country with really smart consultants, telling different businesses of different industries how to do their work better, how to improve processes, train their leaders. And you can imagine a 22-year-old sitting in front of a 55-year-old who has been doing what they've been doing for 20 plus years, how to do their job. And that was very challenging, but it taught me the importance of building relationships, authentic relationships. My first meeting was with a woman who was called Nan. She was angry that we were recruited as a consulting firm. She thought I was coming to fire all her staff. She did not want to help me succeed. She wanted to sabotage me. And I remember looking in Nan's eyes and feeling compelled to have a conversation with her about her life and her children. And I noticed a golf ball on the table. And so my first 2 meetings with Nan had nothing to do with work, but I got to know her. And through that conversation, got to explain that I wasn't going to take anything away from her, but complement what she had and help her succeed and do better. And so together we were better. And that's the philosophy I've used throughout my career. I then moved to nonprofit and worked at the Health Collaborative. The Health Collaborative is a really interesting organization in Cincinnati. Essentially, it serves all the hospitals in the region. So there's 35 hospitals in the greater Cincinnati region that are members of the Health Council, which is now the Health Collaborative. So we would share data, exchange best practices. We brought physicians together, nurses together, learned a lot about health and healthcare and on the clinical side, but then also from the population side. And then after that was recruited to work at the Greater Cincinnati Foundation, which was my introduction to philanthropy. What an incredible opportunity to have an organization that exists to transform communities. And that's where I fell in love with philanthropy. Philanthropy, I believe, has a responsibility to invest and serve communities where they exist. So at the foundation, did a lot of work to build a culture for growth and did a lot of strategic planning. And all that has led me here to really support you in this important endeavor. I've talked to many of you, and the issues are the same. Jefferson County is amazing, has a lot to offer, but there's some big challenges here. And the same issues keep coming up, right? The mental health desert. If you are in crisis and suicidal in Jefferson County, you're a couple of days away from help, which may be too late. Obesity, substance abuse is high, but little resources and services. So all these are things that are hurting our families, our neighbors, our friends. And these are the things that are essentially holding us back today. So we have amazing hospitals here, doctors and nurses who do what they do, and that's going to continue. No one can replace that. But what we have here is the opportunity to invest and focus on the social aspect of health and wellness, and what is it socially that creates a healthy and well community. What are the things that are holding people back from being at their best from a social perspective? How are we going to do that? That's a really tall order, but it starts with a lot of listening and conversation. That's what I'm doing right now. And a lot of what you're sharing is really important, because I think it's important to look at the issues from different angles. There's always one side to a story, but there's always another side. So a lot of listening from different perspectives, and also looking for solutions specifically from those who are really affected by these issues is really important. So we're going to award grants to different programs that are doing well, that are already producing results. And then we're going to invest in projects and programs that don't exist yet, because we really need to consider creating new initiatives that don't exist yet, to pilot them, to figure out what are the ways we're going to disrupt the status quo so we don't keep having the same issues that face our families. So there's a lot we have to build on, but we'll also work together to build new ideas. We'll also collect data to understand and learn what's working and what's not working. We'll look at policy areas. Are there places where we can use our voice to advocate for those who need us? So there's a tremendous amount of opportunity here that we have. And we are a great county that doesn't have to accept the status quo. And the formation of the foundation is proof that you're not accepting the status quo, and that you're choosing to be bold and innovative, just like the 12 women did, to make a difference for this county. One of the reasons I love that story is because in the 1800s, as you can imagine, women lived pretty restricted lives, and there were not a lot of opportunities outside of the home, but they did not accept that. And they not only pushed through, but they thrived and built something that here we are over 100 years still talking about. So the soul and spirit of those women is here. And here we are at this opportunity to not accept the status quo and create something new. So I invite all of you to join this health and wellness movement, is what we're calling it. Go to our website, BethanyLegacy.org is up, and you can sign up to join our newsletter. We're going to be sharing what we're learning, lots of conversations. But pretty soon, in a couple of months, we're going to be sharing some of the priority areas. We're going to test them with you. We want to know what you think and hear your feedback. I'm excited that I've been here for about 6 to 7 weeks, and I'm proud to say I love Madison. This is a wonderful place that I feel at home, and I am so humbled by the warm welcome. I want to acknowledge my family that could be here. So my sister Mamle, my niece Awo, and my nephew Meme, who came all the way to be here. These are my rock, and they're always here. My husband and kids couldn't be here because it's parents' teacher night, and so we're dividing and conquering, but the family is well represented. Thank you. I also want to acknowledge those who made today possible. So Diane, thank you, and Alicia Christuli, Susan Ollendorf, Kathy Rolfling. Thank you so much. If I left out your name, I'm sorry, but thank you for this evening. And the board members that are here, thank you for the warm welcome and the hard work ahead. I'm excited to partner with you all. We can't do it alone, but we are going to build a healthy Jefferson County that will be a model for the country. So let's get going.